Hi, I'm sorry for a couple minutes delay. As you can see that I am now working at home as to comply with the government corporation, with the government request to have most people working from home. And I will be taking turn with another anchor from Thai PBS World, Nat Bunna, to do the midday update for you from home. So this week it's my turn. We're gonna start doing this. Try to do it as most often as possible. It will be started at 1 p.m. and we're bringing you the update of the latest uh, news on COVID-19 outbreak since the evening news last night until now, definitely right after the official press conference by the CCSA. So you will get the official figures and you will also get other updates as well. So we're gonna start with the latest update from the CCSA. So CCSA has reported one more death today. For it is the migrant workers, and he was a driver. Sorry, not a migrant worker. He was a driver for migrant workers in Samut Sakhon province. So let me do a little show you the press conference from Dr. Tuisin. So maybe you can see number as well here. Like you can see that today the new infected case was 365 COVID-19 infections, bring the total of national total figure to 9,331. And we recorded one more fatality, bringing the total of fatality to 66. The fatality was a driver for migrant workers in Samut Sakhon, as I mentioned earlier. He was suffering from hypertension. Then he developed high fever on December 27th. His blood oxygen level fell to 76%. His lungs were inflamed and he tested positive for coronavirus. Then the doctors moved him to ICU on December 30th. He suffered kidney failure and his heart stopped on January 5th. The doctors were able to revive him. However, his body would not respond to further treatment. So he passed away due to respiratory and major organ failure. Dr. Twisin said that he just have to inform people with the detail of death to remind you all that this disease is actually can result in fatality. Dr. Twisin Wisanuyotin, he is a spokesperson for CCSA, the Center for COVID-19 Situation Administration. He said that the cluster of infections of most concern are those from cockfighting rings, which are mostly legal and now should all stop its operation. There are currently 38 cases, all spread in Ang Thong, Nonthaburi, Ayutthaya, Singhburi, and Suphanburi, mostly male and mostly asymptomatic. As in Rayong province is another concerning area. The outbreak spread from gambling dens in Mueang district. Of course, gambling den is illegal in Thailand, and it spread to as many as 8 districts. These infected people were highly active. They visited markets, football fields, snooker clubs, restaurants, nightclubs, and even cockfighting rings. And also there were a question from the media at the press conference. What is the difference between the red zone earlier that they designated 28 provinces into 8 zones, and yesterday Dr. Twisin has announced that there are 5 provinces that they actually consider, they call it highest control and strict area. Those 5 provinces are Samut Sakhon, Rayong, Chonburi, Chanthaburi, and Trai. He said all this 5 plus 23. So right now, red zone has 28, but 5 of those 28 is the highest control area. But all 28 has 3 measures that they have to do that is mandatory. They have to set up screening checkpoints where everyone in the vehicle will be temperature checked. They must have Mochana app on their phone or their device, their mobile device, and they have to explain the necessity of that trip. These three measures is mandatory for all across 28 provinces in the red zone. But if it's the five highest control areas, which I remind you again, Samut Sakhon, Rayong, Chonburi, Chanthaburi, and Trad, people that travel into this area, they have to declare the evidence that they get authorizations from the officials of their residence to leave and to enter different area. And Dr. Thurisin said the difference, like you can see, is the inconvenience. They try to make it more difficult to move around, so they try to restrict people, activities, and movement. Now, the next one, I guess this should be called good news because we are having vaccine coming in this year. Let me show you. We have, let me show you a little bit of the sorry, I see a little bit of the technical issues there, but okay, let me ask something. Let me read some comments from the viewer first. Thank you very much for updating news every day. Every people busy and serious by physical and mental about COVID-19 pandemic. May this virus disappear quickly from the world. Yes, we all hope it will disappear as quick as possible from the world, but in the time being, what we have to do is we just have to just try to save ourselves, be really proactive on all these preventive measures, wearing masks, washing hands, and stay away from other people, and dining alone, or dining with your family only. Now, let's go to the second news. Sorry for that, a little blackout. The second news was broadcast earlier today that the Prime Minister, actually the office of Prime Minister was the office of the Prime Minister was saying that there will be enough vaccine for at least 60 million people this year in Thailand, and that is a lot. The office of Prime Minister announced that the cabinet has resolved to allocate about 1.2 billion baht for the first 2 million doses of COVID-19 vaccine. This first lot of vaccine will have to get approved by China's Food and Drug Administration, or FDA, before exported to Thailand. Then it has to get approval from Thai FDA before being distributed. The pharmaceutical department will be the one that handle the import, while the disease control department will handle the distribution. The first group of people that will receive COVID-19 vaccine in Thailand would be about 20,000 of medical personnel, health volunteers, the field officials in the highest control and strict areas in 5 provinces, and there will be another 180,000 doses of high-risk groups, for high-risk groups. The operation expected to begin this February. In addition, Thailand will receive another 26 million doses from AstraZeneca in May. Though there are not really an official plan for distribution yet, this lot are coming in May, but the government said that at least 60 million people will eventually be inoculated. So I think that's a good news for a lot of people. Now, let's move on to the next interesting news. For a lot of you that actually planning some kind of trip, if you're not in the highest control movement area, so you'll be able to move around a little easier. But I would have to tell you that it will be a little, you have a little less choice to go to the national park because 4 of Thailand national parks closed due to concern over COVID-19. These 4 national parks are the Thaplan National Park, which is Stratos, Prachinburi, and Nakhon Ratchasima Province, Doi Inthanon in Chiang Mai, Pang Sida National Park in Sakao Province, Pukadung National Park in Loi Province, and these places will be closed until January 18 due to the number of tourists visiting the parks from the red zone provinces. They are trying to make sure that they wouldn't end up to be a high risk place for spreading the virus. The spokesperson for the Department of National Parks, Wildlife and Plants Conservation, Mr. Sompot Manirat, said that the remaining 140 national parks across the country, the Ministry of Natural Resources and Environment does not currently plan to close those yet. So if you want to travel to those places, you still able to do so. But like I said, that it will be best if you mostly stay at home. And those places, another 140 national parks are still open, but visitors must book in advance to limit the numbers and strictly follow the safety measures. Like you already know, wearing masks, and probably if you have alcohol gels with you, and stand or stay quite distance from other people. He asked potential visitors, however, to delay their plans for safety's sake if they come from red zone provinces. They didn't say you cannot come in, but it will be for the better for most of the people to just try to restrict your own movement. Khao Yai also top 10 most visited national parks between December 30th and January 4th. Just to give you the picture of how many people visited these national parks. Khao Yai had 75,950 visitors in those 6 days, followed by Doi Inthanon, ภูหินร่องเกล้าจะสอนเขาพระวิหารภูเรือสีน่านภูชี้ฟ้าคลองลาน and ถ้ำหลวงขุนน้ำนางนอน If this latest one sound very familiar to you, ถ้ำหลวงขุนน้ำนางนอน is actually the one that was in the news couple years back because it was the place that the cave search happened. But the picture you see now is one of the national parks that is closed for now, one of the 4 that is closed. So they will be hopefully open for visitor by the mid of January, but possibly they will be extended that closure if it looks like it's going to be higher risk. But right now until the mid of January only. But like I said, there are still another 140 national parks open for visitors, but you have to book in advance. So now let's move on to the next news. Is the news that yesterday Chularachamontri actually made an announcement that asking for people to not perform any social or charity activities that will make them gather a lot of people. The Chularachamontri has asked mosques in the area of Thailand under the strictest anti-COVID-19 controls to cancel Friday prayers until further notice. And the statement issued via Facebook said that the mortuaries in those areas must consult the Provincial Islamic Committee for appropriate measures and outbreak updates. In any province which doesn't have such a committee, the imam of the mosque must consult local administrative bodies to make sure mosques operate in line with the guidelines issued by the Office of Chularachamontri and the CCSA. And this we are talking about mosque and the community in the 5 highest control areas, Samut Sakhon, Rayong, Chonburi, Chanthaburi, and Trat. The Office of Chularachamontri also asked for cooperation from the public by cancelling any activities that constitute a social gathering, such as Dawa trips, charity events, religious classes, and daily, weekly, and monthly prayer sessions. So that is the attempt by the Chularachamontri to help control the outbreak. Now, the next one is actually the warning from the Thai Food and Drug Administration. The Thai Food and Drug Administration are asking people not to buy the test kits to check for COVID-19 infection themselves, as they risk incorrectly reading the result. Now, I don't have any picture, what's it called? I don't have any footage for you, but it's the announcement from FDA. It said that illegally imported rapid test kits being sold online are increasingly popular among Thais, and the kits detect antibodies, but not the actual virus. They will work only after being infected for 1 to 2 weeks. If tested too soon, the infected person will get a negative result. That could lead to a false belief that the person is clear of the virus and may risk infecting others. So these rapid test kits have been declared restricted medical equipment by the Public Health Ministry. The test should only be sold to immediate institutes, to the medical institution or medical personnel, and the vendor must report each sale in Thailand to the FDA. So if you wonder whether you are infected, maybe best to just quarantine yourself, isolate yourself, and see if you have any symptoms. Or if you think you're a high-risk group, maybe consult your doctor, go to the local hospital and explain your situation. The doctor will be the one that see whether you are in high-risk group and see whether you need to take a test. Otherwise, if you insist on taking a test yourself, it have to come out of your pocket. But if you don't mind that, that's okay. But don't buy yourself online test kits, because there is a chance that the result will be mistranslated, and you will even risk more of the spreading the infection. Now, the last news today. CPO. There was a news yesterday. There was a complaint that why the masks that sell in 7-Eleven, available in 7-Eleven by CPO, higher prices than the government price that control at 2 baht 50 cents. So CPO have issued statement. Let me show you their statement if I get it correctly. Here is their statement. CPO has issued statement. CPO is the operator of 7-Eleven stores in Thailand. They responded to the claim. They said that the government control price is for surgical masks, of course, but the masks available from CPO are designed to protect against dust, smoke, and pollen. Those masks are not classified as surgical masks. Therefore, they do not fall into the category which is under government price control. This is the statement issued by the Public Relations Department of CPO. At the end of the statement, they said that the CPO has always adhered to the law and always considered the community and social benefit, especially during the COVID-19 outbreaks. So that is the latest news of what's happening between last night until noon today. We try to bring you as much update as possible, and you can also check our website for more updates, and also our Twitter. It's pretty active, and it's not pretty, it's actually active, and our Facebook post as well. We always keep you updated on what's going on in Thailand, especially right now, the update on COVID-19 outbreak situation. So if you are interested to know more, especially about the COVID-19 outbreak update, we'll come back to you at 7 p.m. today with the Thai PBS World Tonight with Nat Bunnak and me. And see you at 7 p.m. Don't forget to follow us on Facebook, on Twitter, and keep checking on our website. สวัสดีค่ะ